series. So in today's video tutorial, we will talk about pancreaticojejunostomy, that is PG, and it will be a detailed video guide. So whether you are a trainee or somebody who is trying to refine his skills, we will cover all the nitty-gritty details and the procedure in a better way. So friends, in this series we have already covered and uploaded around 4 videos in which we have given a quick guide about the Whipple procedure, the arterial and the link for everything is given in the description of here. You can see that there is no system dilatation. The tumor was averting the knowledge. The first paper is this simplified technique of invaginating pancreatic. True picture will reveal itself. So now we basically divided the pancreatic neck. The specimen is out, and we were trying to cannulate the MPD main.